Good morning, everyone. Dr. Kaylee here, pelvic floor physical therapist, owner and founder of the Hope Doctors. Today, we're going to be talking about what's normal, what's not normal, and what are a few red flags to consider immediately post-birth or just kind of throughout the birth experience. First, I want to go through the things that are normal because I think this conversation really, they don't go over enough, right? Of things to expect, what should you be expecting, what again is normal versus not normal, when should you reach out to pelvic floor therapy? Again, I want to say that this is from a pelvic floor physical therapist perspective. You are most likely going to hear my son in the background. But we are looking at physical activity, right? And like bowel bladder function, intimacy, those kinds of things. And so just know that this is the perspective that that's going into. The first thing that's really normal, especially if it's a vaginal delivery, is a vaginal soreness. So like having soreness there, some throbbing, some discomfort, I would say that can last for the first few weeks. That's pretty normal. If it lasts past that, that's where we're considering a little bit more abnormality. If you're experiencing pressure, and when I say pressure, I mean like pressure down, like you're feeling organ pressure, especially with holding baby, walking, standing, doing different things like that, but you're feeling pressure in like the vagina, vaginal region, that's really normal early on. This can also be quite normal post-cesarean. Swelling at the vulva or the vagina, also very normal. So considering again, you're going to feel some throbbing, a little bit of heat. Now, obviously you're going to know the difference on if it's severe heat, severe throbbing, but if you're noticing just a little bit of that, that's pretty normal. So again, that's not something to get super anxious or worried about. That swelling for the first probably week or so is normal. If it lasts for longer than I'd say 1 to 2 weeks and you're starting to notice it actually worsening, that's when you want to call your midwife or your doctor and let them know that those things are going on. But other things that you're going to notice is like weakness, just general weakness, right? You go through pregnancy and your body goes through all of these different changes to grow a human, to birth a human, and then we birth the human, and then the baby is here and our body's going to feel really weak for a little while. A lot of times we have quite a bit of weight loss in the first couple of weeks and then we kind of plateau or even sometimes gain weight, but the weakness that you feel is pretty normal. And that can be weakness in the core, weakness in the pelvis, that can be weakness in the pelvic floor. Again, expected, normal, we just pushed a baby out. So give that just a few weeks and then we'll start to kind of notice a little more strength coming on. And on that same line, really normal to feel abdominal weakness, like you can't contract your abs, you can't like add that contraction, you don't feel really strong in your core, you really can't use the muscles well as you're navigating holding a baby. Very normal for the first few weeks. And I honestly tell everyone the first 6 to 8 weeks postpartum, it's okay that you feel weakness in your core. You do not need to hit the ground running with core exercise until you feel ready, until your body's ready. It's really normal that that core is going to be weak because it had so much stretch for pregnancy and it went through a lot when it birthed the baby and helped you do that. And so give yourself a lot of grace there. Diastasis recti or separation of the core muscles, noticing coning, doming, a little bit of that gaping is normal postpartum, okay? It is normal for the first 6 to 8 weeks. What's not normal is if that persists long term. Low back pain, pelvic soreness. I'm not going to say pain, but if you have like soreness in the low back, soreness in the tailbone and the sacrum, this does not mean that you can't sit on it. You're just noticing some soreness and overall like, something is different. Things have changed. Very normal. Bleeding for anywhere between 4 to 6 weeks through the vagina, very normal. Again, it's going to have a different smell. It's going to feel a little strange, but that's really normal postpartum. If you have some cramping with breastfeeding, that's also quite normal. That has to do with your hormone shifts and the different things that are going on. But uterus cramping and even cramps in what feels like your ovaries is normal. Fatigue, for a lot of reasons, very normal postpartum. So you're not getting the same amount of rest. Your body has just gone through a marathon event. We've birthed a human. Everything's different. Hormones are different. Really, really normal that you're feeling very tired and fatigued, especially for the first few months postpartum, I will say. Mood changes that shift up and down. I'm not a mental health counselor, but baby blues are a real thing. I always tell clients the first few weeks, if it's sadness, hormones, crying here and there, but not extreme, fairly normal. Frequency of urination, you're going to probably notice that you have to get up and go to the bathroom a lot more frequently. A lot of times you have less urine volume coming out, but you have to go a lot more frequently than you're used to. That's really normal. But you may also have the reverse effect of that, of not really knowing if your bladder's full, because during the birth process you lose a little bit of the ability to tell if your bladder's full. Is it telling you to go to the bathroom? Is it telling you to hold? All of those different things, because the pelvic floor muscles are quite weak. They're lost a little bit of sensation. Again, that's quite normal in those early weeks. Light constipation or a little bit of having to push, use a stool softener for the first few weeks postpartum, also normal. We don't want to be pushing, we don't want to be straining. That's outside of normal. And then flatulence, like even queefing, like for the first few months postpartum is quite normal. You're going to notice that the airflow is going in and out of the vagina and in and out of the rectum a lot easier than it used to, just because of the stretch of the tissue. That does improve if you choose to see pelvic floor therapy. Things that are not normal. So those are the list of normal. What's not normal is if the pressure in the vagina lasts, meaning after just the first few days, first few weeks, if you feel like a lot of pressure down pretty consistently, not normal. Symptom of feeling like your organs are falling out or there's a bulge that stays past 6 to 8 weeks postpartum, not normal. If your diastasis recti stays after 6 to 8 weeks, or you've gone to pelvic therapy, or you've done all these things and it's continuing to give you issue, feeling super weak, not coming back together, not able to engage or feel the core, also not normal. Any type of urinary leakage after day probably 3 or 4, not considered normal. It's not something that you have to deal with. If you sit on the toilet and you cannot empty your bladder, also considered not normal. That's considered bladder retention. Usually leads us down thinking there's too much tension somewhere in the pelvic floor. The urethra is not getting a trigger to open up to let the urine flow. If you cannot have a bowel movement without pain, straining, or you get recurrent hemorrhoids, it's not considered normal, not something you have to live with. That's, again, people make hemorrhoids seem like everybody has them and they're totally normal. Well, they're not. It's not a normal symptom, and so there is help for that as well. Persistent flatulence, meaning cannot control or hold in gas of farting or also queefing. Those are not normal symptoms, and so if that persists past the first, I'd say 2 to 3 months postpartum, we want to address that and see what's really going on. If you have tailbone pain outside of that first week postpartum and you cannot sit down or you're having a hard time with bowel movements because of it, that's not considered normal. Same thing with like just normal day function. If you're trying to do your daily activities and you have limitations or pain with that, or any symptom that's actually like preventing you from going to that next level, preventing you from lifting baby, walking, doing whatever it is that you want to do after that first like 6 to 8 weeks, it's not considered normal. That is considered a symptom that you want to get checked out. Pain with intimacy, once you return to intimacy after 6 weeks clearance or seeing a pelvic floor therapist, which is the best case, that's also not normal if you're experiencing pain. So all of those things are considered kind of abnormal. Most people will say they're common but not normal, but I don't really like that phrase either. What I like to say is it may be common, but you don't have to live with it. And so just know that these are symptoms that can be treated. They are treatable. So give yourself grace, as you know, like you can see a pelvic floor therapist to address all of those things that we just listed. There are a ton of other things that we could consider add to that list, but based on our profession as pelvic floor therapists, that is the basic aspect of it. Now let's talk about a few just red flags that you want to think about early on, just because I have to as a medical provider say them. The first and foremost is like early on extreme heavy bleeding, like more than 1 to 2 pads. You're soaking through your pads, you're soaking through your layers of clothing, you're soaking onto the sheets, those kinds of things. That's not normal. Call your doctor. If you're experiencing fever, chills, or a foul smelling discharge from the vaginal canal, that's also not normal, could be sign of infection, so definitely call. If you have severe pain, when I say severe pain, that's like cannot function with it, can't think because it's so bad, definitely want to call your doctor or go to the emergency room. Same with calf pain. If you have like random calf pain that's not muscular, but it's just all of a sudden I feel cramping in my calf or pain there, could lead us down that path of needing clearance for a blood clot. Chest pain, shortness of breath, we definitely want to get that checked out if you're postpartum and you're experiencing that. Sudden emotional distress or having intrusive thoughts or things that are dangerous to yourself or your baby are other things to reach out about. And if your pain is worsening and getting more severe versus improving, those are things to look out for. Now that is going to be a call to your OBGYN, a call to your midwife or your birth team. not necessarily your pelvic therapist, but we can navigate or help you navigate who needs to be a part of your team through those situations. But those are the things to consider that are like normal, not normal, and also some red flags for postpartum. It's so different for every single person. So just know that having a birth team on your side to help you navigate these different symptoms and changes is really helpful. But I hope this gave you a little bit of clarity. And if you have any questions, please drop them below and I would love to answer them.